Hello everybody, my name is Ingurunziza Leslie and I'm going to be taking you through my presentation, which is Rwanda's healthcare challenges, and this is a case study on service, skills and also technology challenges. So Rwanda has been facing healthcare problems, but the major current issues, as you can see on slide 2, we mentioned shortage of trained medical staff. This can be the burnout staff because there aren't enough staff. There aren't enough doctors. The second one is poor service delivery due to long wait times, and the third one can be limited technology and weak digital health system in rural clinics, and the fourth one is gaps in diagnostics, data systems and medical equipment infrastructure. So why is this problem significant? Why is healthcare significant here? Healthcare issues significant here in Rwanda is because poor services quality results in avoidable death and also delay in poor patient outcomes. And also poor technology translates to poor data quality, which impacts both decision making and diagnosis accuracy, and also the building block for any economic growth and preventing disease outbreaks will be strong health systems. So these are one of the GCGOs that are linked to healthcare here in Rwanda, and the first one is the World Bank, which supports Rwanda by providing funding for major projects that improve health infrastructure and also train more health workers. And the second one we saw is the World Health Organization, which is the WHO. These ones, they give Rwanda technical guidance. They help the country plan its health workforce and choose the right medical technologies. The third one we saw is the Global Fund, which supports Rwanda's fight against HIV, TB, tuberculosis, and also malaria. Their funding pays for health workers, medicine, and also diagnostic equipment, which also strengthen the whole health system. And lastly, we have the Gavi, which is the Vaccine Alliance. This one helps Rwanda with vaccines. They support also the cold chain system and immunization programs, which by doing so, this improves preventive healthcare and also ensures, especially in rural clinics. So with the regions and populations that are most affected by this healthcare issue in Rwanda, we saw the rural populations, especially in the western, southern, and northern province. These ones, they have less access to skilled workers and also have regular supplies of drugs to their health centers. And the second population that is mostly affected is the poor and low income families. These are the indirect cost of seeking better health care, that is transport and lost wages area a key burden. They are most vulnerable to drug stockouts. And then the last but not least, these are the patients with complex conditions, those suffering from NCDs, which are non-communicable diseases such as cancers or diabetes. These require a specialist and technology concentrated in Kigali and often need expensive referrals abroad. So on slide 6, we are talking about the root cause of this issue. And the first one we said is the genocide against the Tutsis in 1994, which reduced the country's working population and its infrastructure base, thus creating a starting deficiency, that difficulty to bridge, whereby these health workers were forced to migrate to other countries due to the genocide that was happening in Rwanda in the 1994. And then the second point is rapid system expansion, whereby this rapid expansion increased demand for services at a rate faster than supply of skilled profession and advanced infrastructure could match. The third one is financial constraints, whereby Rwanda, being a low middle income country, faces a budget limitation whereby it's competing in national priorities. It can also limit the degree of domestic investment possible in expensive medical technologies and high salaries needed to retain specialists. And the last one, we talked about the global market for talent, whereby these talented the skilled healthcare workers are forced to move to countries where there is high income, where they're paying them high amounts of money. Slide 7, these are proposed solutions that we can implement here to increase or to change the healthcare here in Rwanda. To improve healthcare, Rwanda needs to focus on four main solutions. Which is the first one: we can invest in training and keeping skilled health workers, especially specialists, and give them good incentives to stay in rural areas. And the second one, we can strengthen digital health by expanding electronic medical records and telemedicine, so rural clinics can connect with specialists. And the third one, we can build strong partnerships with private sector to bring in better medical equipment and technology. This reduces the need for patients to go abroad. And finally, we can also improve the medical supply chain by using digital tools to track medicine and equipment so health centers don't run out of essentials supplies. So for the future outlook, if no action is taken, this is what we predict could happen. There would be past gains in maternal and child health care could reverse, and there would also be high expenditure on overseas medical referrals will continue to drain the national and household economies. And the third one, people will become increasingly dissatisfied with the service related to public health. So if the right measures are implemented, Rwanda would become a medical tourist hub in the Eastern African region, and also there would be quality primary and specialized care will be provided throughout the country. And also Rwanda will be firmly established as a world health leader. So in conclusion, Rwanda has already achieved a lot in healthcare, but improving quality and specialized care is the next big challenge. So to move forward, the country needs more investment, strong partnership, better technology, and more skilled health workers. So fixing services, skills, and technology gaps is essential for Rwanda's future healthcare development. And thank you everyone for your attention, and that brings us to the end of our presentation. I hope you gained some insight on the healthcare issues being faced here in Rwanda.